This is episode 11, and today we're going to be talking about a medication known as Cyclobenzaprine with the brand name of Flexeril. Cyclobenzaprine is classified as a muscle relaxant. It's commonly used in the short term, that is less than 3 weeks, for the treatment of muscle spasms associated with different musculoskeletal conditions. It's also been approved for the treatment of fibromyalgia, and it also seems to be very effective in acute neck or back pain. Commonly, in practice, I see this medication paired up with another medication that we talked about in episode 1, that is ibuprofen or Advil. Some studies suggest that cyclobenzaprine on its own, taken 3 times a day, is as effective as when it's paired up with ibuprofen. Therefore, it depends on the clinical experience of your physician of how they're going to want to prescribe it to you. In Canada, cyclobenzaprine is only available as a 10 milligram tablet, but you can split this tablet using a pill splitter. It's a good idea to use a pill splitter because of the shape of the tablet. See, it's not scored like some other tablets, so it's not that easy to split. And if you don't use this tool, sometimes you can have variation between the doses that you're using. Some reasons that you wouldn't be able to use this medication, that is, some contraindications, are the use of a monoamine oxidase inhibitor, which we'll discuss in future episodes. If you use these medications within the last 14 days, you should not use cyclobenzaprine or Flexeril. If an individual was in an acute recovery phase of a myocardial infarction, that is, a heart attack, they should also stay away from this medication. If you have cardiac arrhythmias, heart block, or conduction disturbances, you also can't use this medication. And finally, congestive heart failure and hyperthyroidism are the last 2 reasons why you shouldn't use this medication. Some precautions that a physician would use when prescribing the medication are as follows. Because cyclobenzaprine has anticholinergic effects, it should be used with caution in individuals above the age of 65. Oftentimes, they'll start off with 5 milligrams instead of using 10. Also, in regards to children, usually physicians would only prescribe this medication if an individual is above the age of 15 years old. This is because there's no safety data to support its use in individuals younger than 15. Again, back to the anticholinergic effects, because it has these properties, it could exacerbate some of these following conditions: urinary retention, closed angle glaucoma, as well as increased intraocular pressure that isn't necessarily at the stage of glaucoma. It would be important not to use alcohol with this medication for similar reasons that we discussed in our last episode with zopiclone, because they're both central nervous system depressants, so you would have an increased rate of drowsiness or fatigue using these medications with alcohol. The risk of occupational hazard should be mentioned to people prescribed this medication as well. See, because it has the central nervous effects causing fatigue, it can impair your ability, whether physical or mental, to operate heavy machinery or drive a motor vehicle. So as I've been kind of discussing, the main side effects are fatigue and drowsiness. In terms of your gastrointestinal tract, you can find some dry mouth with this medication as well. Less common side effects would be anxiety or confusion, depressed mood or nervousness, abdominal pain and sometimes acid reflux, as well as constipation or diarrhea, and sometimes some local muscle weakness. In practice, we sometimes see it taken just at bedtime, as people have muscle pain that's keeping them awake, and the drowsiness factor does help people sleep as well. Or we see it taken 3 times a day. That can be 5 milligrams or a half tablet 3 times a day, as well as 10 milligrams taken 3 times a day. The maximum dose is 30 milligrams, and it's important to stay below that 30 milligram range because cyclobenzaprine is toxic in overdose. As always, I appreciate you stopping by to check out my videos, and we'll see you guys again tomorrow for episode 12. Take care.